now would like to invite for his welcoming words and the introduction, the Honourable Minister of Public Health, Social Development and Labour, Minister Cornelius the Weaver.
Good morning. I didn't get a clap of hands to stand up again. So gotta wait. Madam Prime Minister, Professor Hassel, Sint, to one and all, it is a pleasure for me today to welcome you here. To our guests visiting from abroad, I want to say a special welcome to St. Maarten, and for our local residents, advocates, foundations, a special welcome to you as well. You always have to appreciate those at home, right? Since this is the first Caribbean Cancer Network Capacity Building Workshop, this is also a historical moment in our comeback to stop the epidemic of non-communicable diseases in the Caribbean. We are honored that our friendly island, St. Maarten, was chosen as the location for this event. We thank the ACC for trusting us to host this workshop. As Ministry of Public Health, Social Development and Labour, part of our mission is to promote the general well-being and quality of life of our population by means of services such as health protection and health promotion. With the knowledge that, although no specific data, or should I say very little data, or should I say dispersed data, is still not available, we know that non-communicable diseases such as cancer, cardiovascular disease, diabetes, as in other countries, are by far the leading cause of death in St. Maarten. Our financial reports show that these diseases place a huge burden on the healthcare system of St. Maarten, placing an even ever-increasing burden on our healthcare expenditures. NCDs are responsible for considerable loss of quality of life and the main cause of premature death for both men and women. These diseases are preventable through healthy behavior by eliminating casual risk factors such as tobacco use, unhealthy eating habits, and a lack of physical exercise. The socioeconomic burden can seriously be decreased by means of early detection and screening of diseases. It is our responsibility and the conditions sine qua non to have in the country a health system receptive of and geared towards the needs of its user or users to ensure health and wealth for all people living on St. Maarten. This system must be maintained through a continuous cycle of quality improvement where technical expertise, information technology, and input from the grassroots organizations are important sources of feedback for government to fine-tune policies and legislation according to the needs of the people. With our policies and national health program, it is our goal to decrease and delay the mortality, mobility, and disability due to priority NCDs, thereby increasing productivity and ultimately improving the quality of life and life expectancy. With specific focus to NCDs, our goal is to establish and implement a comprehensive national strategy for the implementation of an integrated approach for prevention, management, and control of chronic NCDs and health promotion. Specific objectives of these programs include raising awareness for preventable diseases and its related risk factors through our Get Checked program, increasing access to care by bringing prevention services to the community by means of mobile service or services, supported through our mobile clinic, to increase the quality of life with healthy lifestyle promoting activities, decrease morbidity and mortality for cardiovascular diseases, hypertension and diabetes, breast cancer, cervical cancer, and prostate cancer, and reduce the complications from these diseases. Decrease the cost for secondary and tertiary care for patients living with these conditions. With this said, the It should be clear that agreeing to co-host and co-organize this event was not just seen as a privilege, but for us, it is also an opportunity to support and empower our stakeholders in their endeavors to contribute to alleviate the burden of NCDs in general and cancer specifically. As Minister of Health, I see it as my duty to support this event, of which the results will contribute to the health and well-being of our people in the Caribbean region. Professor Trevor Hassel, President of the Healthy Caribbean Coalition, I compliment you and the organization you represent with the work that you are doing. I also want to thank you last night for moderating the well-attended meeting and panel discussion on men's health, men take charge, get checked. Thank you for that as well. I couldn't let that slip by. I also appreciate the role you play as advocates for society, and I embrace the task you took upon yourself to empower civil society organizations through training. I am convinced that these 2 days will be fruitful, and I look forward to the results and the recommendations that will come out of the deliberations. I know last year we hosted a networking for cancer conference, and this is definitely a follow-up, like we said it would be. So I want to thank each and everyone for making sure that this happens, and I guess I wish you good luck, and I hereby officially open up the conference.